Okay, and our agenda today is we'll go through some welcome and introductions, and then we'll dive into the Baking It In resource, the purpose and structure, the introduction, essential elements, and then we'll move into breakout room discussions. We really want to provide some space for you all to connect and discuss, and we'll go over some additional resources and then time for questions at the end. Next slide. I'll quickly go over the Zoom features. The bottom ribbon moving from left to right, you can mute and unmute yourself. You can use your webcam to turn it on and off. You can select the participants button to raise your hand or react or see who else is in the room. You can join the chat. Please feel free to use the chat for comments and questions throughout the webinar. And you can select end to leave the meeting at any point. And there are also live auto-generated captions, and there's a link to that in the chat. Next slide. All right, and my name is Kala. I'm a health scientist on the Technical Assistance, Coordination and Translation, or TACT team. We are in the Prevention, Practice, and Translation branch in the Division of Violence Prevention at CDC, and I am co-presenting with my team member, Alice. And I also want to introduce and thank our partners at NSVRC who are providing support. We have Jennifer, Sally, and Mo, and I want to thank and introduce my CDC colleagues who will provide facilitation support of the breakout rooms. We have Kelly, Candace, Sierra, and Shayla. All right, and now we're going to dive into Baking It In, integrating health equity into violence prevention. So the goal of the resource is to operationalize health equity. And as you may know, recipients are expected to identify populations and environments that experience inequities due to disproportionate access to conditions for health and safety, and to select programs and practices based on the best available evidence that reduce the conditions that increase risk for violence or increase access to conditions that promote health and safety. So this resource was developed to assist recipients in meeting these expectations by providing an outline of how to integrate health equity into multiple aspects of violence prevention and present actionable health equity principles. Next slide. So the document is structured with the introduction, including the connecting concepts and the purpose of the resource. And then the essential element sections, the what, how, and who. And the additional resources are the appendices. And we have partnership, the capacity assessment, partnership development, and finally, a list of resources that are integrated throughout the document. And if you haven't seen it, the PDF is in the chat for you to open. Okay, and these are the connecting concepts presented in the introduction and woven throughout the resource. So we use an anti-racist approach to address social and structural determinants in order to achieve health equity. Firstly, we think about social determinants of health as the circumstances in which people live, work, and play, and the policies and processes that limit or expand access to critical resources, such as food, housing, transportation. And social determinants are impacted by structural determinants, which are the economic, social, and political forces that influence access to those critical resources. So we lead with an anti-racism approach because racial and ethnic inequities pervade all the social determinants of health. So addressing structural racism is essential to achieving health equity. This then leads to addressing social and structural determinants, which will improve the conditions in which we live, learn, and work and play in order to achieve health equity and eliminate violence in our communities. Therefore, to achieve health equity, it is important to address social and structural determinants. All right. And we are using the essential elements framework to estimate health equity work because there is no singular way to increase health equity. And this framework really allows for flexibility depending on your local context. Essential elements are the active ingredients of a prevention approach that are assumed to be responsible for achieving the intended outcomes. So the essential elements of a violence prevention approach are the what, the how, and the who that describe what approach, content, and standards should be delivered or implemented, how they should be delivered, and the characteristics of who should ideally deliver or lead an approach. And for more information on the essential elements, you can go to Select, Adapt, Evaluate on veto violence. So each essential element in the resource includes the significance of the element, considerations for implementation, and a brief example of the essential element in practice. All right, and now we're going to dive into the what essential elements. Heads up that we might refer to the essential elements as EEs in the slides. That's what that stands for. So we'll briefly describe the what essential elements and then why they're important, and then we'll dig further into a couple of elements using examples. So they're all essential. We're just highlighting a select few because of time. So the what portion of essential elements describes the content of violence prevention strategy or approach, including the key messages, design elements, and policy components. So the first essential element is to prioritize those with the most burden and with the most need. So a concentration on those with increased risk for violence can be especially important because prevention activities meant to address a universal or the whole population can fail to consider the core issues creating the inequity and in the process widen rather than shrink those inequities. The second element is to address the structural and social determinants of health. Addressing the determinants includes expanding the understanding of what causes violence. Instead of focusing solely on health behaviors and individual risk and protective factors, try to focus on the environments, the policies, and the systems that impact the violence type that you are trying to prevent. The third element is to identify and transform negative dominant narratives about your violence issue. So public narratives are shared stories that connect issues to values. They generally reflect deeply held cultural beliefs, and many people share them. They often shape the extent to which we choose to prevent violence. The last what element is to implement sustainable community solutions. So once you've come to understand what the desired impact is, consider whether it can be maintained in the absence of the program or whether some portion of the program would need to continue. So those are the what elements, and we'll go to the next slide where we'll now dive into a couple of the essential elements. So it's critical to address the social and physical environments in which people live and the structural factors that contribute to those environments as they influence individual behavior and the risk of violence. And as you address and examine structural and social determinants, consider how they've been shaped by oppression and how they contribute to inequities and violence. Considerations for implementation include to determine what is known about the underlying causes of inequities for that form of violence, such as concentrated poverty, over-policing, and limited access to high-quality education, and determine which social structures or practices might have led to these inequities being created, maintained, or increased. Consider which of these social structures or practices need to be addressed to create the change you want to see. Next slide. So this is an example of this essential element in practice. This example demonstrates how a recipient addressed structural and social determinants of health. In response to findings from a survey of teens across the state that showed they were experiencing relationship and sexual violence, the state health department worked to educate and inform state legislators on the results, which helped pass several laws strengthening resources at schools. So this involved expanding sexual health education curricula to include violence prevention, enacting policies contributing to sexuality and gender affirming social norms, and ensuring that surveys are funded to include data on sexual and relationship violence indicators. So this example demonstrates how prevention activities focus on more than just behaviors related to violence and address those determinants creating the conditions in which violence occurred. Next slide. So the next element we will highlight is to implement sustainable community solutions. So it's essential to consider the sustainability of prevention activities. Changes that go beyond outputs and individual level change that can be maintained in the absence of the program have the potential to fundamentally impact systems long-term. So instead of thinking about sustainability solely in the realm of funding, consider ways that your project will fundamentally change corresponding systems. Implementation considerations include considering what ways your program supports sustainability and ensure that these ways complement your goals, and involve all partners in developing a shared understanding and commitment to the sustainability of the initiative. So throughout the webinar, we will be spotlighting a couple of examples of your peers and colleagues' work that demonstrate an essential element. So this example comes from the work of the Idaho Coalition Against Sexual and Domestic Violence and their state health department. Focusing on young people from communities most impacted by violence, the state health department and the coalition provided community level funding for projects and initiatives created and led by young people and supported by adult mentors and allies. Mini grants provided community funding of up to $1,500 to young people in partnership with adults to co-create solutions to sexual violence in their schools and communities across rural and urban Idaho. The mini grant program facilitates reaching hard to reach or yet to be reached communities because they are awarded to groups that are storied to be historically marginalized communities. And the coalition guided funded projects and created a community of support for each project to learn from others. And this process allowed grassroots groups and smaller organizations that may not typically apply or be able to apply to receive the grants. So this demonstrates an investment in community champions and local organizations, bolstering their capacity and contributing to sustainability. And at the end of each of the what, how, who sections, we'll just go through a case study that demonstrates all of the elements for that section. So this is a case study example demonstrating all of the essential elements for the what. So the Colorado Sexual Violence Prevention Program funds grantees to prevent sexual violence through two focus areas, to create protective environments and strengthen economic supports for women and families. So SVP is focusing on increasing equity through its funded programs, policies, and practices by providing equity-focused technical assistance and supporting authentic conversations with partners and the community around the intersections of racism and oppression. SVP also supports a continuous quality improvement for implementation to ensure grantees are impacting and engaging priority populations. SVP conducted an equity audit, which supported grantees in analyzing their efforts to reach those most impacted by sexual violence and encouraged ongoing conversations around how to be more accountable to reaching those communities. SVP utilizes a shared risk and protective factor framework to engage a wide range of sectors, increasing access to resources and funding and promoting sustainability. For example, they engage a partner that focuses on promoting healthy eating and increasing physical activity, which is a bit different than their focus, but they have a shared interest in creating safer communities and have shared expertise in key areas that support the work. Okay, so we're now going to take a couple of minutes to respond to this question on a Padlet. So the link has been shared in the chat, and the Padlet platform allows you to provide your responses anonymously, but for everyone to see them as they are filled out and posted. So if you can click on the link and go to that Padlet, to post to Padlet, you click the plus sign underneath the question about the question that's on the slide and type your answer and then select publish to post it. So the question is, what social and structural determinants of health or root causes of violence do you prioritize in your violence prevention work? And what challenges do you face in addressing SSDOH? Let us know if you're having any trouble accessing the Padlet. In addition to the discussion questions that we'll go throughout the webinar, there's also a space in the Padlet for you to ask any questions that come to mind throughout the webinar. Of course, you can use the chat, but this is an alternative way to provide questions or ask questions anonymously. So I'm just going to be quiet and let people answer the question about social and structural determinants of health. There are no wrong answers. This is just a way to brainstorm together. Jen, you might have to hit refresh because it's showing up for me. All right, this is great. And I see some people are extra eager and starting on the second question. And you don't have to go to that one yet. We're focusing on the first one, but appreciate the enthusiasm. So I'm seeing a lot of different things here: racism, oppression, poverty, norms. All right, thank you all for participating. And again, feel free to ask questions in that space all the way to the right if you have any throughout the webinar. All right. Now I will pass it over to Alice to get us started with the how section.
Great, thank you. We are seeing the presentation mode with all the notes. Great. So as Calla mentioned, the second category of essential elements is the how. So these relate to how you all can actually do the work that you do, specifically targeting some of these health equity issues. So the first element, if you can click the first one, is to explore with partners issues related to violence in your community and determine how to address them. A lot of times we collaborate with a lot of different partners, but this is really a reminder to work with not only the people that you work with a lot, such as other coalitions, state health departments, things like that, but also partners who may either specialize in the communities that you're trying to reach or may be totally new and be not previously involved, such as private business partners or anyone else in the community. And these people can really bring a different perspective into the work that you're doing and or help you leverage other resources to really widen your reach. You can also make sure by working with partners that you are not doing duplicate work, and that can be really important because, of course, we have limited resources. The next one. This one is to use local data to identify priority populations. So whether this be needs assessments or existing data that provide disaggregated information, local data can be super useful because number one, it's targeted to the communities that you are working in, but also it can involve some of the community members, or it can be more up to date or tell a more nuanced story so that you can better understand the populations that you're working with. Next. The third essential element is to engage with narrative change activities, such as messaging campaigns. Now, this is really important because a lot of times when we think about interventions, we want to do some sort of activity or hold a workshop, things like that. But a lot of the violence issues can be perpetuated if some of these larger narratives, these kind of collective understandings of who is affected by violence, when it's important and when it's not to intervene, things like this can be really critical to making sure that we are actually creating long-term sustainable change that really resonates with the communities that we're working with. So there are many different ways to do narrative change, but a lot of them can involve messaging campaigns with posters or social media or things like that. Next. The last essential element is to ensure the initiative is building the capacity of involved local partners to continue the work. So with this one, it's a bit similar to the first one in terms of partners, but when you're working, especially with local community members, you want to make sure that they are not only participating, but that they're understanding how to do certain things, they're expanding their skills, and they're able to potentially carry on any work that they're doing after RPE funding has run dry or after the specific set timelines that we have are over. So working with local partners, making sure that they're receiving training, that they're understanding how to do all of this work is not only really important for sustainability, but it's really important to make sure that they have the tools to advocate for themselves, potentially if we are overlooking something. Next. So to elaborate a little bit on the first or on the last essential element, which is to ensure the initiative is building the capacity of involved local partners to continue the work. This is a lot of what I sort of explained already, but it's essentially this idea that we want to prioritize the local the local organizations or leaders or any community members that are interested in responding, because not only can they fulfill the needs that we have in our projects, but if they have the ability in the future, they are going to be able to respond to any emerging needs and not have to rely on one certain violence prevention program or our specific funding. So when you're thinking about this, and I apologize for the flickering light, but when you are thinking about implementation, a lot of it can come down to understanding how your organization can engage and work with these partners, and whether you are working collaboratively or sort of almost wielding power over these local partners. And you want to lean towards the first one rather than the second. You can also bring in experts or give some of the expert partners in the community different trainings or help them develop different skills that can really advance this goal. And then also to foster reciprocal relationships. So not only are you providing some trainings and engaging local community members, but also learning from them and seeing their perspective and being able to incorporate any of their feedback so that they understand their importance to you, but you also understand your importance to them. Next. An example of how a coalition did this really well was from New Jersey. So they have the Coalition to End Domestic Violence, and they were working with the Department of Children and Families Division on Women. So they created a program that is called the Men of Courage. And what they did was they recruited these men to lead action groups and be community liaisons. So they were able to provide a stipend for these community liaisons to essentially conduct some of the on-the-ground work that they needed. So community-based activities, really engaging boys to prevent violence. And how they tried to build the local capacity was by holding monthly meetings, coordinate community gatherings so that all of these community liaisons could meet and kind of learn from each other, share their experiences, and build their connections with each other. And they were also able to provide all kinds of assistance to these action group members. So in the end, not only were these men and these community liaisons able to help, play a really critical part of the program, but they also learned some skills. They met and built relationships with others in their community so that they could better continue to be involved in the future, even after the Men of Action groups were over. Next. So to give you an idea of a program that was able to utilize all 4 essential elements, we have Michigan's use of greening for violence prevention. So if you are maybe unfamiliar, greening is a practice where a city or a health department is able to really kind of reclaim some urban spaces, make it greener by planting trees and plants and things like that, and really able to create a more welcoming environment so that people feel more comfortable, and that in turn can reduce violence overall. So part of what went into this whole process was first the selection of Detroit, which was informed by a local needs assessment. So again, collecting and using that local data to inform the actual program. The second point is that they worked with partners and existing data to emphasize the importance of having Detroit be a local point. Be a focal point and the initial site for greening work. So with that data that they had collected, they also discussed with partners to figure out how, where and how exactly to go about this greening process. So they were able to bring in their partners and really create buy-in from a lot of different organizations. The next point that they did was use resident leadership. So they relied really heavily on local community members to make sure that these greening efforts were equitable, that they met the needs of the community and did not promote gentrification. So this is related to the fourth essential element, capacity building and sustainability. So really relying on and empowering the local community so that they could understand what it meant to have an equitable program, how to identify some of their needs, and then how to prevent gentrification. And then lastly, they wanted to change the narrative. And they did this by creating a social marketing campaign. So they created several infographics and different messages on greening and how greening related specifically to IPV, meaning intimate partner violence prevention. And all of those were posted onto their social media accounts and in physical spaces. And those linked to websites and social media accounts that provided more information. So there was a lot of education that went along with all of the greening work. Next. So we will go back to the Padlet for this. The question for this time is the second one, and I know some of you have already put down some thoughts, but how can or does your coalition work with strategic partners to explore the issues related to violence in your community? And if you've already added some ideas, you can feel free to read through some of the responses from other people, and perhaps that can give you some more ideas, or it can spark some questions that you can feel free to add to the question box. All right, so continue to add in the information, but I think it's really great to see we have statewide youth mobilization programming, rape crisis centers, presenting at each other's conferences and sharing messaging. I think that is super helpful to be able to really see how other people are doing that. So if you have data that you're sharing with each other, that is really wonderful. Community assessments, interviews with community members, data work groups, very interesting. All right, and I'll move on in about 1 more minute, so get the rest of your thoughts in. All right, let's head back over to the PowerPoint. So we will talk a little bit about the WHO essential elements now. So the WHO is talking a lot about who you should be working with for all of your different programmatic needs. The first essential element is to develop alliances with diverse sectors that focus on root causes of violence. So the root causes of violence that we're talking about are social inequities that create community conditions where violence is more likely to occur. I know a lot of you put down things like racism or poverty and things like that under the first Padlet question. But it's really important to partner with a variety of sectors, including businesses and private owned companies, because they can really help create a lot of buy-in and resources and help a lot of times if we as public health practitioners are speaking on a subject, it's not as powerful as if a local business is talking about it. So that can be a critical partnership. The second essential element is to develop long-term relationships with economically and socially marginalized communities based on a shared interest in and concern for addressing structural and social determinants of health. So this is really about working with communities and looking at that relationship long-term. A lot of these communities can have histories where working with the government or working with coalitions can not have the best outcomes for them, and it may take some time to really cultivate that relationship and make sure that you are responding to their needs as they express them. The next element is to ensure leaders and partners examine their organization's social location and their individual relationships to racism and other forms of oppression. This is sometimes also known as positionality, which is essentially understanding who we as public health practitioners, that we have some sort of power in the whole project and implementation process. So we want to really understand what specifically our organization and work, what the current and past relationships have been with health equity, racism, and other forms of oppression, and keeping that in mind when we're doing our work. Next, we want to dive into a little bit of the first essential element, which is developing alliances with diverse sectors that focus on root causes of violence. So a lot of times when we have different partners, they can help us leverage resources, power, and other subject matter expertise that can really enhance the work that we're doing. So when you're thinking about implementation considerations, some things you can think about is participating in campaigns and projects that are initiated and led by others. So this is really like if you are cultivating relationships with friends, for example, you're not always the one who is hosting something and trying to organize something. If your friend is hosting a party or organizing a get-together, you can also show up, and that is just as valuable as if that came from you. The other thing is to know that tools exist to support practitioners to identify partners, their strengths, and the role they can play. So, of course, not all partners are going to be the same. Many of them bring different expertise, different resources, different relationships with others. So it can be really helpful to think through what you want from specific partnerships and understand what different partners can provide. Next. An example of developing alliances with diverse sectors is the Maryland Coalition Against Sexual Assault. So one thing that they were able to do is partner with a statewide nonprofit. And what they did was, working with this nonprofit, they were able to increase coordination and collaboration among community resources and organizations, specifically targeting the LGBTQIA+ communities. So the coalition itself, of course, is involved in many, many different things, but this specific statewide nonprofit was working a lot with the LGBT plus community. And so they brought a lot of expertise and collaboration and relationships with that community. So what they did was this partnership really helped enhance the capacity of community service providers and rape crisis centers through trainings and sharing of resources and tools. And then as a result, they were able to reach a lot more people and provide some economic security services and prevention messaging for LGBTQ plus communities. So with this partnership, they were able to really expand their reach, which was really, really beneficial to everyone. Next. And another essential element that we had was to ensure leaders and partners examine their organization's social location and their individual relationships to racism and other forms of oppression. So as I mentioned, it is really important when you're trying to conduct health equity work that health equities is an expressed value and that it's used in decision-making throughout the entire process of any work that you're doing. So the organization really needs to understand what the relationship with health equity, racism, and other forms of oppression is so that they can effectively do this work. So implementation considerations for this is that when you're working specifically with different communities, it can be very helpful to work with community experts and have them weigh in on many of the different things that you're doing, whether those be organizations, individuals, community leaders, or people like that. And if you know that a certain group has had negative past experiences, it can be very helpful to specifically address what these experiences are and what the learning was from that, so that anyone that you're working with can understand not only that you are acknowledging that this happened, but also what the future will look like to prevent any future negative experiences. Next. So an example of this is the Louisiana Foundation Against Sexual Assault. So what they were able to do was support their staff to educate themselves about addressing health disparities and their relationship to health equity. So a lot of this was supporting self-reflection, providing some checklist guidelines for different things that they could ask themselves to really reflect on their position. And then they convened affinity groups for partners and prevention educators. And what they were able to do is work through a booklet about addressing health disparities through sexual violence prevention, understanding how these health disparities really manifested in their local communities. They were also able to discuss different strategies and how to address health disparities in locally relevant ways. So this really means understanding the local context very well, understanding, what they have done as a sexual assault coalition in the past, and how they could make sure that a lot of the lessons learned were implemented into their future strategies. Next. Yes, this one. So the case study example here is Rhode Island's Transgender Action Coalition. So this example is one of Rhode Island integrating all three of the essential elements here. So what they were able to do is they created a coalition led by people who identify as transgender, with the inclusion of agencies with credibility who have worked a lot with this population. So allowing people who identify as transgender to lead the coalition is really a second essential element, building long-term relationships with socially marginalized communities and deferring leadership to them. And then the inclusion of agencies with credibility is really drawing on partners and making sure that they have a commitment to health equity. And they were also able to work on economic, workforce, housing, and school environments by drawing on alliances with different sectors, which was the first essential element. And then they also helped conduct policy work in response to community input. So this is a part of building long-term relationships with marginalized communities because number one, they were soliciting that community input. They were able to create it into policy recommendations and actually able to show these marginalized communities that their voice mattered and that the input that they were giving could actually change policy and allow individuals to use their chosen names on shelter IDs. All right, so for this last slide, if you go to the next one, we will be looking at the last question of who. So the question is, which communities should be given priority for your violence prevention efforts and which will not? And please open up the Padlet again and add some thoughts. You can also explain a little bit about why or why not. And there can be many different reasons that you are thinking of those. So it can be helpful to share some of your thinking. All right, so thank you all for adding in your thoughts. I think we have a good mix of communities that should be and should not be prioritized. I think we will take a minute to address some of the questions that were left here. So we have 3 questions so far, but feel free, if you think of anything, again, to drop questions in the chat or in the Padlet. Carol, I'll let you talk about the questions.
Sure. I'll take a first pass at responding to questions, but also allow any of my colleagues to provide any responses that come to mind. So they're all very great questions. The first one is, how do we define community? And I don't think I have a satisfying answer for that. I think it depends on the context, on the setting, on the population, on the context of what we're talking about. And ideally, community members would contribute to how their community is defined. And does anybody, Alice or other CDC folk, have any responses they want to contribute?
No, I think the idea of engaging people that you're working with and asking them what their feedback is on what that community looks like is really great. It can be sort of a physical thing, but it can also be people who identify in certain ways or part of a particular group that already exists. So I think there's a lot of flexibility there in terms of like who is being targeted for some of the programs that we run.
Thanks. Okay. The next question is on the screen. So I think I saw that distributing curricula across the state was addressing SSDOH. Which SSDOH is this addressing? So that's also a great question. The case example included educating policymakers to improve and increase resources and policies that contributed to sexual and gender affirming norms. So we're thinking that this improves the environment so students feel supported and safe in schools, and therefore improve their access and quality of education. Okay, and the last question is a good one and a big one. In order to focus on groups most at risk, we need local data. Many of our programs don't have access to that, don't see the need, don't have capacity, or don't have organizational approach. So they might rely on large countrywide data, which might not translate and lead to stereotyping in under-resourced groups that might actually be oversaturated, leading to a savior, complex, or scarcity approach where there might be a lot of strengths in that population or community. How do we rectify this kind of reality with this health equity messaging? I think that's a really great question, and I will also open it up to anyone who feels like they have a response. I think that one approach would be to working with a variety of sectors that might share some interests or be addressing similar risk and protective factors, whether they're focused on violence or some other shared factor that might have some sway or might be able to leverage their resources or might have data themselves, and identify champions that might be able to further your case for local data. I think that this seems to be about, I think, finding a way to have, an asset map, a community needs and strengths map would be very useful for contributing to your messaging. And I think that I would take this as an opportunity to really message how important the data is. Does anyone else have a response to this question?
I think what I would say here is a lot of times we think about data, we think about large surveys and a lot of quantitative data. But perhaps in some cases, especially with difficult to reach groups or with, groups that are really resistant to large surveys, interviews or focus groups, like focusing on sort of qualitative data, asking a few people about what their experiences are. I think this can provide some really great insight. And it's going to be a little bit different, of course, from the data that we can get from surveys and quantitative sources. But I think a lot of times in situations like these, asking a few people who are able to share their knowledge and kind of rely on that subject matter expertise can really be really important.
Thanks, Alice. All right, that's all the questions that we have in the Padlet. So now we will move on, but feel free to continue to use this space for questions.
All right, so we are preparing to go into breakout rooms. If you will go to the next slide, we will be in breakout rooms for a little bit. And what we're going to do is talk about the questions that we had you put into the Padlet. So we'll be splitting you all up into, I believe, 8 groups. And the first part of the focus of the group will be talking a little bit about these 3 guiding questions and sharing some of your thoughts and kind of going through the discussion there. And then if you'll go to the next slide, we'll speak a little bit about these guiding questions. So these will be: what challenges does your coalition face in incorporating health equity into violence prevention work? And what resources or support would help your coalition incorporate health equity into your violence prevention efforts? So these will really be an opportunity to kind of think through some of the challenges that you're facing and how we, especially here at CDC, can support the work that you do. And you can feel free to continue adding any thoughts that you have to the Padlet if you want to share that information. But you can also feel free to just listen in and contribute to your breakout rooms. So we will have maybe about 20 minutes to go through the breakout rooms.
Okay, thank you all for your participation in the breakout rooms. We have just a couple minutes in this larger room if anyone wants to share responses to these questions with the whole group. You also have the opportunity to answer in the Padlet as well. But does anyone have anything to share in this larger group right now? Okay, well, feel free to put it in the chat or put it in the Padlet if you do want to say something that's shared with a larger group. And for now, we're going to transition into a really brief overview of the appendices, the additional resources in the Baking It In resource. There's 3 appendices. There's the Health Equity Capacity Assessment to help recipients identify areas of improvement for their organizations in advancing health equity. The Partnership Development Resource to help recipients identify new and existing partnerships to enhance for promoting health equity. And then finally, an evaluation resource to help recipients integrate health equity considerations into their evaluation efforts. All right, and this is a bit of a change of pace, but we just wanted to quickly provide an introduction to the resource that was shared with you a couple of weeks ago. the primary prevention capacity assessment resource, which is intended to support you to assess the capacity of your organization to conduct primary prevention and health equity work. As a reminder, the use of the resource and the assessment tool is optional. And the purpose is to provide suggestions on strategies to complete the assessment, describe capacity areas that should be addressed, and provide guiding questions for assessing capacity areas. All right, next slide. And the first few pages describe and provide some background on who and how to use the assessment, as well as a glossary. And the assessment tool is comprised of 6 overarching domains: leadership, staffing and resources, skills and expertise, collaboration and partnerships, data and valuation, and health equity. And each of those domain includes a space for you to score the close-ended questions and document some action or recommendation steps. And then there's a summary section at the end where you can compile all of your recommendations for action and document any potential barriers and the potential feasibility of enacting those. And finally, there's a list of resources related to capacity assessments. So please reach out to your project officer if you have any questions about using this resource. And we can take a couple of questions now, either about the capacity assessment or about baking it in, or anything that has come up over the course of this webinar. We'll just feel free to come off mute or drop them in the chat. Or anything that came up in the breakout rooms that you want to share with the wider group. All right. Hearing none, we can go ahead and first of all, thank you all for your participation, and please fill out the webinar feedback form. The SurveyMonkey link is in the chat, and it will also be emailed to you along with the recording. And just we are leaving a couple of minutes for you to do that. And thank you again for attending and for participating. We really value your input and feedback. And we'll also just be on the line for a couple more minutes if any questions do come to mind. All right. Thank you, Jen and Sally and Mo. Your support was critical. Appreciate it.
No problem. I'm going to go ahead and stop the recording.